Hello, my name is Jin Park. I'm a physical therapist with Howard Head Sports Medicine and the regional manager for Summit County. Today, Nathan DeGraff is going to join me for some videos and partnering with the town of Frisco and the Adventure Park to assist in your orientation for injury prevention. You guys bring a lot of joy to the town and a lot of joy to the tourists that come in to complement their skiing and snowboarding and bring a lot of thrill. I've enjoyed it myself, so I appreciate you. Let's have Nathan introduce himself and we'll see what we're going to do today.
Hi, my name is Nathan DeGraff. We're here to talk a little bit about some safe shoveling and lifting techniques for you guys over at the Frisco Adventure Park, so you guys stay safe and healthy and have an excellent winter.
All right. So today what we're going to do is look very quickly at some anatomy, the challenges of bending, lifting, twisting, and review the proper lifting, shoveling, and tube tossing techniques. And I'm just going to go over a little bit about low back pain and how we approach things. So this is the anatomy. There is a picture of the vertebrae in the spine, which composes of the lumbar, thoracic, and cervical. There is a disc in between each one of these vertebrae, and there's also nerve roots coming out from in between each one of these vertebrae. And what I'll say is that a majority of low back pain is going to be related to muscular strain. So if you're having some pain in that back, it's usually just a tight muscle. It's just kind of gotten overworked, especially with the type of jobs you guys do. However, if you're noticing that the pain goes down into your hip or even down into your legs, there could be compression of one of the nerve roots. If there's compression of the nerve roots, quite often it's resulting from a disc issue. If you look at this disc, it looks similar to a jelly donut. The inside is a very viscous jelly, which is the nucleus pulposus, and the outside is the annulus fibrosus, which is just this really rigid soft tissue. What happens is that in a healthy tissue, that disc and that gel will stay in the middle. However, if you're doing a lot of bending and lifting, that gel will start to get pushed out, which could cause a bulge in that disc. If this is the case, then you'll basically have a little bit of pain. But just so you know that many of us actually have bulging discs and we don't even know it and we go about our day. So just because you hear that diagnosis, don't freak out, because quite often people will have them and not even know it anyway. We're going to take a look at a couple of pictures of things not to do, like Homer Simpson. You'll see this shoveler, which is something that we all do up here in Summit County. We want to ensure that we're not shoveling with a bent back, again, because that's going to feed into the pressures on the disc. And then with this shovel, he's probably adding a little bit of twisting, which is never good. The same thing with this young lady is that she is bending a lot at the hip, but she's also putting a lot of pressure in the curvature in her low back and then not utilizing her knees. And this is the employee that decides to send it with every client that comes in. Let's load them up, let's throw them as far and fast as they can. I know everybody appreciates going as fast as possible. However, we want to make sure you guys start the season and finish the season with a strong and healthy spine and have no issues. The next slide we'll take a look at is a correction. So they'll see that his spine is nice and straight, and he's using his hips and his knees to properly shovel. This young lady's also decided to change by having a straight back and utilizing her hips and knees to lift this weight. And this young lady is going to have a nice, long, healthy season by working that tubing hill, staying low, not sending it, and kind of just being mindful about how hard she's pushing, just so she ensures she's taking care of herself as well as taking care of the client. So from lifting principles, I think the biggest thing is just making sure you're not bending or twisting, and Nathan is going to show you a video of the proper technique. But before we go to that, I just want to demonstrate how if you do lift properly, 10 pounds will translate to 10 pounds in the spine if you've done properly. However, imagine lifting in this position, which we've all done, and 10 pounds will actually translate into 100 pounds of force on that low back, which quite often puts pressure on that herniated disc. All right, now let's go to Nathan DeGraff.
We're going to talk a little bit about safe lifting techniques. Now, as the most important thing to remember when you're lifting things is to keep your spine straight. Whenever your back bends too much and you try to pick things up, you're putting a lot of stress on those structures talked about in the PowerPoint with the discs and the zygapophyseal joints and all that kind of stuff back there. So, the most important thing when you're lifting is to keep your back neutral and straight when you're picking something up. So if we're going to come to this box and lift it by a squat technique here, you're going to squat down, making sure your back's straight, pick it up, bring it to you, and stand up. All right? Keeping your back neutral the whole time is the best way to stay safe and avoid back injuries. Same thing when you're setting it back down. If you want to squat with that back straight and set it down gently, without increasing any kind of lumbar flexion in your spine.
Perfect, Nathan. That's actually a great video demonstration of ensuring that he used his legs and not necessarily bending over with his spine. Next thing we're going to go to is the shoveling principles. Again, the same concepts goes, just don't bend over at the spine and don't do a lot of twisting. Let's see what Nathan says about this.
Next, we're going to talk a little bit about safe shoveling techniques. Same principle applies to lifting. You're going to want to make sure that you keep your back neutral and you let your hips and your legs do all the work like they're meant to avoid those spine injuries. So whenever you're shoveling snow, you can push it. It's obviously the safest because your back can stay straight and neutral. But when you've got to scoop it and actually lift it up, getting into a position where your back's straight, you're bending at the hips, you're bending at the knees, you scoop, pick it up, and the most important thing is you actually stand up and turn your feet to toss it, right? Any of this twisting your spine to toss it puts too much stress on your back and can lead to injury.
Perfect. So moving to the last kind of topic, it's kind of the majority of your folks' jobs, is the tube tossing. If all of our clients could be as cute as this dog, then we'd have a really great day at work. So the principles of tube tossing, again, is the same throughout lifting, and is keeping a wide base, making sure you're using your legs, and making sure you're being mindful about not sending it every time. We all know that it does increase the thrill by going faster, but it is not a thrill to have low back pain, and we just want to make sure that you're mindful of it.
Next, we're going to talk about safe techniques for pushing a tube, like you guys are going to be doing quite a bit of at the adventure park. We don't have a tube, so we're going to use this box to demonstrate. The same principles apply. Bending and twisting at the back are not good for it. So what we're going to really do is get in this position with your back straight again, getting low, being able to push that tube without being bent over. If you're pushing the tube here, it's going to lead to a lot of stress on your back and possibly result in potential injury.
All right, and that was our final video in regards to the work-related injuries. If there's ever any questions, Nathan and I are both available, but there's also exceptional physical therapists in all three of our Howard Head clinics in Frisco, Silverthorne, and Breckenridge. I think this is a good opportunity to mention that our Silverthorne clinic next summer will be moving to our new Dillon facility. And so we're opening up a really exciting project with the Ambulatory Surgical Center. So we'll be partnering with Vail Summit Orthopedics and Stedman Clinic, and be offering occupational health and also primary care services. In closing, what I want to do is talk to you directly in regards to injuries, especially of the low back. I think a lot of physical therapists kind of overestimate people's perceptions and understanding of when they're in pain. And when you do get low back pain, it is very worrisome because you hear herniated discs and you hear strained muscles, and it's a big part of what we do out here when we ski or snowboard or go to work is we use our back all the time. I want you all to understand that a good majority of all low back pain improves if you do absolutely nothing. if you think about the times where you just woke up with a stiff back and maybe you stretched just a little bit and it went away at the end of the day, that is a majority of the issues. Even if you have a herniated disc, that herniated disc can heal. What is wonderful about physical therapy is that we're giving you and educating you and diagnosing these situations so that we can improve the healing rate, so that we can get you better and get you moving as soon as possible. So that is ultimately what we're here for. If you have any questions, Howard Head Sports Medicine is here to address them. And I just want you guys to also be safe. We've been frontline workers throughout coronavirus and continuing to work on folks with injuries and pain and dealing with surgeries. And we're trying to keep our economy going, and you guys are a big part of it, and we appreciate you. So just continue to be safe. And like I said, call us if you have any problems. Thanks again. Bye now.